Barbara, Rebecca, Lori, let me know when you're ready to be unmuted.
I forgot I had unmute myself. Well, I wonder if everybody should remain unmuted during this. Do you think so? Just to, and then if somebody gets a phone call, we can mute them, just because there's not many people and we can get a different type of interchange.
Yeah. I'll switch it up. Rebecca, is that cool with you?
And Lori, is that okay?
Yeah, totally.
Okay. All right. Everybody is now able to unmute themselves. So I will mute whenever, I'll mute people whenever it seems necessary, but
right,
should be just fine.
So hello, everybody.
Hello.
Hello.
Hi.
Hi.
This is really good because not only are people on, but I've been getting emails saying, can't be there, but this is what we want to discuss. So I found that very exciting. Lori and Rebecca, you got it from Will and Brian. Did he send to everybody or just me, Brian? Guerrero?
No, I only got from Billy and Sarah.
I mean, yeah. Okay, well, we have one more minute and then we'll get started.
Can you hear me?
Yeah.
You can.
Yes.
Okay, because I don't know. This is weird. I'm seeing a split screen.
Because right now I'm sharing my screen with the agenda.
Oh, okay. Okay, got it.
So as soon as I stop doing that, you'll all go back to your normal screens.
Who was I hearing? Ellen?
Ellen.
Yes, that was Ellen.
Hi, Ellen.
Hi.
All right.
So when anybody wants to know, we have another minute to go. Is Wilma on? I know she usually calls in. Is she on?
Not yet, but I'll keep watching.
Did she call you for the number today?
Mm-hmm.
Okay.
Yeah, I texted it to her.
And Alita is going to be late. She's going to come, but she was driving when I spoke with her and she said she doesn't think she'll make it by 6:30.
Okay.
But she has something she wants to talk about also. So it's exciting that everybody has ideas. It's exactly 6:30. Do you want to get started? Give me the, or should we wait another 5 minutes? Do you see anybody signing in, Will? Can you tell?
Let me check. Yeah. There's only a couple of people who've signed in who are not already here.
Okay.
So I will be muting you guys if I hear feedback from your microphones while you're not talking.
Okay.
Just unmute yourselves back. But if it gets to be too much, then we'll go back to.
Yeah, we'll go back to the usual way. It's just that it's a small enough group and people
Mm-hmm.
want to interrupt or say something else. I would like a dialogue. I'm hoping that there's a dialogue rather than a set meeting as usual. This is somebody speaking. It's that type of thing.
See if that helps.
And once we get started, let's make sure Billy can speak early because he has a pretty crazy schedule.
I didn't read it. I just saw his email. Is he coming?
He's here.
He's here.
Oh, Billy, you're here. Oh, great. All right, then
But I know his time is limited, so I want to make sure he gets the chance to speak early.
okay, then I'm going to get started then. And then anybody come in, we could go backwards, okay? Billy, how much time do you have?
10 minutes, 15 max.
Okay. Then I'm just going to give a slight introduction. This is the Health Senior Social Services Committee, which also includes criminal justice, or when one chair left, Alita asked if that could roll into our committee. It wasn't a big deal back in those days, and I think it's become a very big deal now. So we have a lot of issues to discuss. We call this meeting that came out of the land use meeting when there was a discussion about what should we do about racial injustice. And I think that two things came out of it. One is there should be an overall committee. Anthony, I know you're going to be co-chair of it, so you could
Yes.
explain it if you would like a little bit more. But I think if that is more of a general discussion, and then the committee meetings would be a much more specific thing. Housing would do things on housing, education, and we would do something on health, senior, social services, and criminal justice. Do you see it the same way, Anthony?
Yes. Yes, actually, I do. I think that there's a kind of, let's say, overarching quality to I'll call it my committee. I apologize.
Yeah.
But I think each of the other committees have their own responsibilities to pay attention to all of these issues, and obviously health, seniors, and social services is a real logical place.
And criminal justice.
And criminal justice, yes, sorry. And criminal justice. You know, I mean, I think it's some committees I think are, to be honest, like, I mean, I'm going to pick on landmarks, are less involved in issues of racial equality than other committees. But that doesn't mean that each committee can't, in its own way, try and contribute. Anyway.
So I'm very pleased that there seemed to be a lot of interest. I did speak to people and write to people, and people contacted us and sent information. So I think we'll start with the last part of it, which is criminal justice, because I know that's what Billy is interested in. Will, is there any chance you could call Wilma and say get on the phone? Because she was part of that also. Thank you.
Let me check to make sure she hasn't joined.
Okay.
But
She hasn't joined yet.
no. So yeah, I'll send her a text to make sure.
Okay, Billy. So now I don't have to read your email, right? You're going to say what you had in your email?
Sure. Yeah, no problem. So, and I'll try to keep this brief. You know, the history, a little bit with this committee, and this is something Barbara and others know well, but there was a public safety committee and was folded into this one. And so in speaking with a few people on this committee, you know, we were talking a little bit about how can we think about our role in addressing public safety and criminal justice issues. I think there's a lot that's on people's mind these days. There's a lot of talk about bail reform. There's a lot of talk of defunding the NYPD, and what does that mean? You know, I think a lot of people hear defund, they think, oh, no more funding, as opposed to, say, a budget cut, which is happening to lots of programs and agencies right now. But what do these things mean? And I think we could do events easily on bail reform. You know, did it go far enough? Did it go too far? What does bail reform mean? What is the purpose of bail? I think a lot of people don't even, you know, start from that point. We could have a whole event on the New York City Police Department budget. And I don't have a problem with doing those things. But what my email says, and I think this is the larger point that I want to underscore, I think we could really drive a larger conversation around what does public safety mean in the year 2020. And my personal view, this will just be my view, is we have a cramped definition of public safety. We often think of public safety strictly in terms of what the NYPD does, as opposed to say, what does it mean for public safety when you have youth employment programs, education programs, healthcare, public health, mental health, investments in communities. I think there needs to be a larger conversation that defines public safety and almost looks at it through a public health lens. So I'd like to see us do that. And I think given that we have the word health in our committee and that we have a public safety component, I think we're well situated to do that. So I'm getting a message that I should raise my camera angle a little bit. So I'm going to do that. Let me know if this worked. Thanks, Will.
That's it. I always.
Yeah, no, I don't know the art of doing the right Zoom situation. So, okay, I'm learning. But my bottom line is that we should discuss, how we'd like to take this on, whether we want to do it in bite size, in September or October. Here's an event on bail reform. The next month, here's an event on the NYPD budget. Or we could try to get it all done in one event that could really, I think, encapsulate a lot of this at once. And the last thing I said in my email is if we do an event on any of these things, obviously we want a lot of points of view represented. So I think we could have someone from the 19th precinct. We could have someone from the Manhattan DA's office. I would urge us to also include a public defender. I would urge us to include a formerly incarcerated person. And I would urge us to include someone whose expertise is more in social services, what it means to really invest in the health, education, welfare of communities that frankly are often over-policed communities. You see over-policing, but then you see underfunding and everything else. And so that's kind of my pitch to this committee for how we should consider taking on the criminal justice component. I can stick around for a few more minutes. I'll have to hop off, but I'm happy to touch base with Barbara or anyone else later to see what you all think.
I'm going to throw out a question. I agree with as you know, we talked and every one of your thoughts. The question is, are we better taking little modules where maybe we could come out with a resolution? And my hope is that we come out with something that says elected official, mayor, assemblyman, whatever, we need a change and we want to be part of the change. An overall committee, which I have to say, our committee, the Health Seniors Committee, has done big thoughts, and I love big thoughts, but you don't come out. And that's a question I'll have for anybody that comes in and talks about it. Yeah, I mean, what we hear now is that health equity is public safety equity, and we know that everything is connected. How do we deal with each one of them and then as a whole also? And I don't know. I don't have an answer for it. Do you, Billy, or anybody else? That's why I wanted to mute people if anybody wants to come in and say something about it. No, really? Yes, Anthony?
Oh, okay. I think there's a very strong case for small bites here, because none of them are small bites. They're all big issues. The sort of bail reform, defunding the police force. These are actually, each of them by themselves are big issues. And I think that it's fair for us to sort of focus on a single issue at a time.
Right.
First of all, because I think we're all suffering just a little bit from Zoom fatigue.
Yes.
And the shorter we can keep the meetings, the more focused we can keep the conversations, I think the better off we are. And I think that Billy's notion of having meetings that have someone from the DA's office, someone from the public defender's office. I know people through my son who worked at Rikers on issues with, worked at Rikers on, sort of the most at-risk, mentally at-risk prisoners. Probably the wrong word, but prisoners. And I think that getting a sort of perspective on what the criminal justice system means to the accused is, I think, very important. And I think that that's part of what we ought to be looking at certainly on this committee and certainly in the larger committee as well.
Well, I have an idea that just came to me. Would it be what Billy talked about with a big idea be better? I'm going to say your committee for better things. For what is it? A task force, a committee, whatever it is at this, whatever it's
Committee.
called. Committee. That's, I think of a committee with overarching ideas within the particular parts. And I'm afraid when we get into the other areas besides criminal justice that we can, I mean, maybe we'll create 15 months in a year rather than just 12 because,
Right.
but maybe we would think of combining two things. I don't know. Could it be bail reform and defunding, or certainly defunding and talking about other avenues for a PAL program or youth program or a community watch program or something like that. I think, do you agree, Billy, that certainly can be combined, I think. Do you agree? Does anybody agree? Everybody talk.
Yes.
Yeah, I agree. I agree. And I think, the only downside to taking it in small bites is, it's just more meetings. And if we're only planning to do it through this committee and have one meeting a month, it's going to take a long time to get to whatever the end goal is. If we want to treat it almost like the contact tracing series, where we have several events in more rapid fashion, then I think it makes more sense. But I'm open to dragging it out a little bit longer, and I think small bites is probably the way to go. And I do agree, Barbara, that you could combine some of these issues. If it's an hour-and-a-half event, you can do 45 minutes on bail reform and 45 minutes on the police budget, for example.
Yeah. Why don't we figure out like the logistics after? Rebecca, your face is saying something.
I was just going to say, I thought the contact tracing series went really well, especially because, each meeting was focused kind of on a different issue. And then the one where we wanted resolutions, we made sure to keep it very focused on what we wanted to address. So I think if we could kind of frame them, because I have a feeling we're going to continue with these Zoom meetings for a long time. If we could frame it kind of under that lens, I think we could actually get a lot done.
And maybe work with the other committee too, which I see has an overlap, and maybe see what role they have. And I almost see like one could be a feeder to the other. Is that possible, do you think? That one could be?
Yes, I think there's a kind of, and I don't know. I mean, I haven't thought about this very much, I admit, yet.
Anthony, I'm one of these fascinating people that go to bed thinking about things like this.
Yeah.
Sorry to
No. I wake up in the middle of the night thinking about it. Yeah. And Wilma and I haven't spoken at all yet, really. We're going to have to schedule a meeting. But I think that you're right. There's a kind of role for the overarching committee, and maybe the issues that we're sort of we've immediately zoomed in on, which have to do with criminal justice, essentially, might not be the most important for this particular committee. That this particular committee might be able to focus more, or should focus more, or can focus more, I don't know what the right word is, on something like health equity. That the problems that rich people have better access to health care. And so how do we figure out a way to help everyone in our district
absolutely
get health care, in the same way that the housing committee has to really dedicate themselves to thinking about housing equity.
Well, but this is all part of it. We started with this because of Billy's time. I wanted is Alita on the phone yet?
Not yet.
Yet, is she?
No, but Wilma is.
Yep.
Hi, Wilma. I don't know whether what was said. I think pretty much what we discussed before. The question that we're talking about, all these issues about bail reform and all of that, whether it should be an overarching committee or a small committee and things like, and we may
I think that it should be a smaller committee, because if you put bail reform and you put issues like criminal justice and other things together under those issues, it's too much. It's got to be broken down smaller and smaller parts, because it's just such a wide range of problems
Right,
that can be worked on.
right. Does anybody on the committee or that's on the phone? I'm sorry, I have to step back. Will,
Yeah.
is Shelby from the borough, from the council member's office here?
Yes.
Oh, I'm
Kayla.
sorry. Oh, Kayla.
Shelby.
Sorry, it was the wrong name. Kayla, can you give us 1 second just to finish this thought, okay?
Absolutely, no problem.
Okay, great. If everybody agrees that these are issues, because I don't want this meeting to go on forever, and I have to tell you, there's so many issues to discuss. Would it be okay if we sort of brainstorm and maybe send emails? I don't know if we're allowed to send emails back and forth, but just organizing the committees, like how to approach it. Would anybody object if it's not done at
No.
this meeting, but later on? I think we're gonna be here to midnight if we hash out.
I think it's a good idea. I think that you should move the meeting on. We have a basic idea of what we want, and we can take it from there at another time. It's just too much at one time to discuss right now.
Right.
We have some ideas and some things that came out of this, so we have something to work with.
That's right. So I think that the three main areas, and not that little things don't come off it, are going to be bail reform, what does defunding mean, and what should be funded? I'm going to put it that way. What are the other, I think you put it very well, Billy, the other public safety things that are not necessarily police, and what else can be done. Does anybody not agree with me?
I agree, Barbara. And I'm getting a little nervous here, because knowing that we may be paying for 12 months here, but we have 24 months worth of issues that we're talking about. And so I think we have to be realistic. And I think perhaps the idea of having like a big forum where we could get a lot of people to talk about the criminal justice system. I know you want to come up with a resolution on this, but it may be that we need to plan for a big event to bring in a lot people.
All right, Ellen, I have another. I'm going to just play a little bit.
And then go on to the next very large topic.
Okay.
Which might be healthcare, which might be social services.
It is.
So many. Our committee
we do have
a large
we have two committees. We have this overarching that Wilma and Anthony are co-chair. It basically an injustice committee that's over. So we have to think about it. And my feeling is, now, please, Lori and Rebecca, tell me if you disagree. But it doesn't mean that members of the committee we can't have two meetings 1 month where other people sort of take it over and do things with it. I mean, do you agree, Lori and Rebecca?
I agree, but I also found, just based on working on the contact tracing series, that having working groups that aren't as committee dependent, if you're very focused and interested in one issue, could be a good use for these issues.
I'm going to ask if we could go on to the next thing.
Wait, Barbara, 1 second. Can I just ask a question? What is the committee that you, Anthony, and Wilma are chairing? What is it called?
Wilma?
Sorry, don't ask such difficult.
First of all, I talked to a leader. I talked to a leader this afternoon, and I just think that Anthony and I need to talk to each other.
Yeah.
I don't think we off the top of our heads, at top of our heads, in a meeting like this, could come up with any plan. We should have contacted each other before the meeting, Anthony and I, But I did speak to a
Okay.
leader, and I talked to Anthony about it.
All right, so, but you are the committee that we spoke about at the last meeting.
Right.
When we had the big, like, what are we gonna do about,
Yes.
racial, issues? Okay, all right, fine.
Yeah.
I just.
So that's,
Yes.
that is more of an umbrella, where each committee is more of the individual issues. Alita's still not on, then I'm going, first of all, I'm sorry. From Ben Kalos, I'm sorry, I keep forgetting names. Can you please?
Kayla, no problem.
Kayla, I'm sorry, Kayla. Will you interrupt? Do you want to say something? Do you want to just interrupt us and give your point of view? I don't know what. So we spoke with Ben Kalos's office because he's our council member. And the last minute I spoke to them today. And do you have anything to say, or do you want to just listen and get back? Or I don't know how.
Is it okay if I listen and get back?
Absolutely. We would love
Awesome.
that. Thank you.
Of course.
I'm going to, Lita said it's okay if I tell what she had to say. She spoke to me, I don't remember if it was yesterday or I don't remember one day from the other, to say that will we be willing to do something on preparedness? And I said, yes, but I think September is going to be a little too late. And she's trying to convince us to do something in August on are we prepared? And I think we can nervously say no, that we're not if we have another spike, if a Florida.
Oh, that kind of preparedness.
Yes, that type of
I
preparedness.
was wondering
I'm sorry.
for what we were prepared.
You're
That's
right.
okay.
that type, like what will the next round? What are we doing?
Yeah.
And there's been a lot of, I think it was a Stringer that had some ideas. There's been ideas all along. That would be fairly quick. Alita has asked to have it in August, no vacation this year. What do people think of that? How do you think close? Who we would get, what we would get? I have no idea. I haven't.
Peggy, you can
in
unmute yourself.
August.
Sorry.
Is it in August just to be the preparedness information?
Well, the reason August is because the fear is, I know Alita has that fear and I have a fear about everything.
Mhm.
So I will agree with anybody that has any fear that September is going to be a bad month. It's we have to hope that's not true, but certainly we should be prepared. And one of the things that worry me is they're upping the number of tests, but you don't get the result. So
Barbara, can
yeah.
I say, I would actually think it would be smarter to do this in the fall rather than August, because there isn't a spike now. It seems that the issue is that in the fall, could be a spike.
That's right, but are we prepared?
That's why we need to talk about it.
What she wants to talk about is, do we have a plan? Are we getting our labs up to date? Do we have enough PPEs? I think,
Yeah, and more people would be around. I mean, people are going to go away in August
people
somewhere.
are going away.
I think that my vote, if there were a vote, would be
Okay.
September would be a really good time, or October, but September would be a good time. People will be around. We'd have more of an idea of what's happening nationally. Right now, the issue is, it's more of a Southern issue, but preparedness, I think the city is just right now trying to figure out how to deal with now rather than prepared. We might get better information in September. Just my opinion on the subject.
Does anybody else have an opinion?
I have an opinion on this.
Okay.
I feel that why we're waiting to September, if they're expecting a peak to happen around then. And also, there are a lot of people that are around, or even if they're at a different part of New York, upstate or whatever, we're doing this virtual meeting, and they will be able to be in on the meeting of whatever we are prepared to talk about. I think it's very important that anybody that have ideas about how we can not be so afraid for September, October, November, even if it never happens, discussing it, for me, discussing it on how I could possibly help myself in September, October, when it spikes, if it does spike, we don't really know. But I think it really helps to talk and plan. And that's the problem, is that nobody really plans. And we have an idea what's going on now and how it's happening all over the world. So we have an idea of, I mean, are we really ready to do anything? No, we don't even know what to do. But if we can discuss it, come with ideas, maybe somebody could come up with a fantastic plan.
Barbara, could I say that it seems like if you're going to do a preparedness session, that you'd want to have speakers, and would they be ready to speak in August, or would some other time be more appropriate for them?
I have found that people are very willing because they don't have to travel. You can get somebody from Chicago or California.
That's right. Yes.
And people aren't going on vacation. I mean, they may be going to their vacation home, but I don't know. Is anybody planning a vacation?
No.
No.
I am,
No.
but that doesn't mean I won't be available. I mean, I'm always available.
Exactly. I think, go ahead, Lori.
I was just going to say that I'm not issuing an opinion either way about whether or not we should meet in August. But as far as September is concerned, I think that the primary overarching issue is going to be what's happening with the schools, because that is an incredibly large and impactful decision, because parents have to deal with, are my children going to be at their school? If they're going to be at their school, am I going to be in danger, when they come home? The teachers are going to be freaking out because they're not sure if they're okay. And then if they're not going to do it in school, then there's the issue of home care, and whether they are, there's just the whole mess of issues that in September are going to come to the fore. So I think if we are going to have a meeting in August, it should deal primarily with that. And I don't know that we can do that because I don't think the decisions have made yet, are made yet, so people don't know anything. So I don't know who we can.
The Youth and Education Committee. That isn't our committee. What she was saying was more.
Well, it's the Women and Families Committee. It's the, it's the elderly.
No, but it's also health.
It is health also. Of course.
Barbara, could you make a subcommittee to go back and to look into the timing and some of the people that might speak on some of the social service, juvenile, criminal culpability issues? Because August is a lousy month, regardless of pandemic. Yes, it's easier to corral people into a Zoom than it would be to ask them to arrive in person. But I think maybe a subcommittee could begin to make the preparations, and I'd be happy to be on a subcommittee. And
Meryl is our new second public member with Ellen Pallavi. So this is Rebecca and Lori, and this is Meryl Brodsky that has joined.
Honor to meet you. Thank you so much for including me.
Of course, the more the merrier. Alita's here and she's raising her hand, so I just want to make sure we.
I am. Thank you. I wanted to address what Lori had said, which is that Peter Patch and the Youth Education and Libraries Committee is actually, I believe, in conjunction with Keith Powers' office, having a meeting on Monday with representatives from DOE on the reopening of schools in the fall. So as far as what the DOE knows, those things are illegal, and you're not supposed to be on the sidewalk on those.
I want to hear you yelling at somebody without a mask also.
Well, I actually think that Meryl is right that, the committee can do preparations in August and then have speakers lined up for September. It would be.
I know you had suggested August for the meeting. I don't know when you came on. Did you hear me paraphrase what you were saying? And I hope I did it correctly. Is Alita back?
I think she's still talking to whoever she was talking to.
Still yelling.
Oh, I want to hear that.
All right.
Wait. I just want to say, so the education stuff should be and is being looked at by the Youth Education and Libraries Committee. If there's something you'd like to do jointly, then by all means, you should talk to Peter about it. But right now, he's doing something, I believe, with Keith Powers. Peter was set for Monday. Keith is doing something on Monday. So Peter wanted to coordinate with Keith. So, so they're working on that.
Was your issue, and I don't know if you heard me. I was.
Oh, my issue, my personal thing.
And Peggy was saying that she doesn't think August is a good time. That if we get a peak, it won't be till September. What is your feeling about timing? And what?
I think for some issues, there are a number of community boards that are actually meeting in August, even though they generally don't, because of things starting up again and issues that are really crucial. So I'm thinking if you guys want to do, and I would work with you if you're interested in working with me, something on preparedness so that we look at what, and there are a lot of aspects of it, but what should the public hospitals be doing? What could we be doing to ensure a more equitable, I guess, virus impact and more equitable healthcare? FOMO added 10 states today to the list of states that requiring quarantine. So now there are 31 states. That doesn't look good for us. Yeah. So I think if we look at this and try and figure out what do we need, what could people do, what could individuals do to prepare, you know, not stocking up necessarily on toilet paper, but what other things could or should we be doing? What should the city be doing? I understand Scott Stringer, I haven't looked at it yet, said something about H&H and needing to be better prepared. I know what happens on Roosevelt Island was a disaster with Kohler. So do we want to have groups that make you sign religious proclamations before you could volunteer there, or even, I guess someone said, be treated there? I don't know. These are all kinds of issues that come up that fall within your very, very broad auspices.
That's true.
I think we should.
However, I will say one thing, and please, I hope everybody understands my politics, but they actually treated people. I don't know if you heard how many millions of dollars went into the tennis club in Long Island, and they were paying nurses $2,000 a day to stay on their phone and look at Facebook. It was totally ineptly run. And I mean, this is when you're desperate, the last
Right, desperate. So there's a lot of stuff and a lot of lessons to be learned and a lot of application for things, because there is an awful lot of anticipation of a second surge. And I think if we deny it, despite the quarantine stuff, we're really putting our heads in the sand.
And also labs, the fact that they say tracing, you know, testing. But if you're tested and it takes 8 or 9 days to get the results back, it's not very helpful.
Mm-hmm.
So we need to do something with the labs. I don't want to attack one thing that was done before. I think we know we don't have any minds about that. I unfortunately passed by Mount Sinai during April 1st. And it was horrible. We don't want refrigerated vans to throw bodies in anymore. And it was horrible to see. It was
well, even worse than
will be going away very fast.
I think it's important to have some kind of meeting in August for the preparedness. There's a lot of different categories, and I think that we should start in August.
I think you should. I think it, depending on what you want to do, if it has to do with COVID, then I think an August meeting would be worthwhile. People, even if they go on vacation, if they're interested, they're not going very far, or they're not getting on planes and going to Europe or Asia, mostly. So, and people are around, and there's a lot of interest in what's going on. So, I don't know if there's something that you think is important and relates to the virus sooner rather than later.
And the virus does relate to racial injustice, because we know it was the Black and brown communities that were worse. And it could possibly be grouped with other things along the way. I know said that, but August is not right. Does anybody else think that we should not do it in August? To me, to do it in September is missing the time span when.
Oh, I think we have a meeting. I don't see anything wrong with that. Certainly to touch base on everything that's happening in the pandemic, and the quarantines are crucial issues. But I think it's also preparatory. If people have something, they should think about it now as to maybe presenting it in August, and maybe in the future, September, October, actually making a full-blown report and for
Paz has his hand up, and he's had it up for a little while.
I think
Bring down.
rather than discuss this for the next half an hour or so, why don't we get a general consensus on whether it should be in August or September or October or 21, 22? Let's vote on this and end it.
I agree. Hi, Kaz.
I agree.
I think it should be in August, and if everyone is comfortable, just because of some of the things that have been mentioned, that any board member who can't come for whatever reason, because it is in August, will get an excused absence.
Okay, great.
I agree.
I agree.
So criminal justice, we have a hands full of criminal justice. This is the first thing of health. By the way, just to get through with seniors, I think that one meeting really should be on a model of nursing homes, and specifically, I guess, if we're doing racial justice with the public hospitals, what went wrong overall. Is the model of a nursing home a model that isn't perfect anymore, or I think that could be maybe a little bit later in the year. I don't know. What do people think of that issue? That's been brought up also.
Well, we've been doing research on nursing homes. If you want to do it jointly with the Women's Committee, that would be great.
Okay. Fine, if you want to do it. I don't know. How does
Great idea.
Okay. I'm going to just read what Brian Carrera wrote, if I have it. Which one was his? He is an insurance person here, and he wrote he couldn't come, and he said he did have two ideas. One is the expansion of telemedicine during and after COVID, and he has a speaker that he could talk about it. That certainly is something we could talk when we talk about what would the new healthcare be like and so on. That certainly can be fit in there, is that telemedicine. And if we could have somebody who talks about what it is and how successful, that could be good. Let me read the other one and then we could talk about it. The New York State Health Marketplace during an epidemic, that's changing. And the governor's push to make a plan options more affordable. I guess what he's saying, so you know what, Rebecca, do you want to read what Sarah Chu wrote?
Yeah, sure. Let me, hopefully, I've been losing internet and sometimes phone service on my phone. I do not know why technology hates me these days. So let me make sure I can open it.
It's getting sick-consuming also, right?
What?
I said your computer's getting sick of Zooming also.
Yeah, I think so. All right, so I can read what Sarah wrote to us. As we examine healthcare, seniors, social services, and criminal justice, I feel that it's hard to consider the issue of equity without asking if we could examine universal access to healthcare. We are seeing job loss impact health insurance due to COVID-19, and the group of people who are both disparately affected by job loss and disparately affected by COVID-19 are Black and Brown communities. We are at once condemning them to both poverty and disease. To the extent possible, there must be a way to decouple employment and health insurance. Unrelated to COVID-19, this decoupling would also ensure that women get the health care they need without regard to their employer's personal preferences. Perhaps the committee could also investigate how universal healthcare accessibility could impact society as a whole. Can we collectively live better lives if everyone can access the care they need? Aside from pandemic settings, it could impact vaccination rates, improve quality of life, improve mental health, increase the capacity and resiliency of the workforce, ensure humane care of people in correctional custody, etc.
And I think that whatever Brian was saying about insurance can certainly fit in somehow with this.
Wait, who, I'm sorry, who is that from, Rebecca?
Sarah Chu.
What?
Sarah Chu.
That
Yes,
was excellent.
I
that was
agree with
excellent.
everything she said. And let me ask you this. Do we think that Alita will have any change of heart on the issue of dealing with healthcare for all? I mean, I know she's been really resistant to it, but I'm just wondering if like.
But I'm right
Oh,
here,
you're on the
Lori.
phone? Oh,
Yeah.
good.
I've actually been on the phone. So, but
Okay, I'm
that's
sorry.
okay. I don't have, it's not a change of heart. You can deal with the issue. It's the long-term care insurance and the two viewpoints. I've encouraged the two committees to work together because you're looking at it from different points of view. And so that's, if you want to work together, that's fine, but it's not a question of either everyone paying or everyone going, or only about people going on to Medicaid. It has to be something that is more far-reaching than just one alternative, whatever that
No, I'm
alternative
sorry.
might be.
I was not talking about that. I'm sorry that I was not clear. It's not, we're not talking about the long-term care. I'm talking about the, what's it called? The New York Healthcare Act. Ellen,
I've
your
never
cue.
taken a position that you shouldn't discuss that. I think you should. I've taken a position that people are not interested in voting in a certain way without information. They can't vote for it or against it in terms of a resolution if they don't understand what the legislation is or it doesn't answer their questions. That's my point. Not
okay.
that I'm opposed to anything.
All right. I'm sorry that I misunderstood. I thought that you were like against it, you know, from the
No.
get-go.
The only thing I was against was a narrowed focus on a specific area of healthcare, but no.
Okay.
There just has to be adequate information and the ability to answer everyone's questions. And my recollection is that there were a lot of questions.
Yeah. I don't know if it has to be the New York State Health Act specifically. In fact, I asked Sarah if she would be able to help us with it. And she says she does have people from, I have to look up, from some health group that can work on it. I don't know if we want to I'm not sure how to readdress it. Ellen, I know you feel so passionately about this.
I'm very passionate about it, but I don't think we should readdress that. I think we should address what Sarah wrote, which is more the moral and the ethical questions and the reality questions about linking healthcare to employment during COVID and health crises. So it's a different focus. I think we need to step to the side away from the New York Health Act and really address what Sarah talked about, because that's much broader.
I have a question of what's happening with everybody. In one day, thousands of people lost their job. I think we all know somebody who lost their job. And what's happening to their health insurance? Is everybody going on Obamacare? Will some of them go on Medicaid? What is happening with all these people? And I think it would be very interesting to speak to it and realize the problems with employment-based insurance
That would be great. Yeah, I think that's an excellent idea. And the sooner, that's one of these issues that I think that you should address sooner rather than later. It's a pressing issue.
Yeah.
And it would be very relevant to our community.
Yep, I think so. I think all of it is.
Not to step back, but just because Brian, had mentioned telemedicine. And again, especially given the context of this meeting, I wanted it on record that we can't address that without addressing the digital divide. So if that's a topic we want to explore, we need to make sure we're exploring all sides of the
Would
issue.
that be our committee, or would that be a technology committee or some other committee? Is that something? I don't know. I mean, certainly.
I think it can come from our committee. It's just if we address that in the future, we have to make sure that we're looking at some of the other issues involved.
Mm-hmm. Right. And I think we can get people to do that. Let me just look, what other issues do people want? So,
I also think, John, on the healthcare end, I think we need to look at the changes in Medicaid, because it is disproportionately affecting people, the very poor people. There are people, and this is apropos of the nursing home, people of the committee looking into nursing homes. There are changes in Medicaid right now that that are seriously affecting people that are in nursing homes. Like, you go into subacute rehab, and for whatever reason, maybe you have to stay longer than 3 months, and then you're being disenrolled out of the managed care company you were in, and then you can't go home because you can't get the number of hours back because they're just not giving them anymore. So people get stuck into the nursing homes once they are there, and then they're forever in the nursing home rather than being able to like stay as long as they need to in the nursing home and then go home. So
Yes, Ellen, the Women's Committee will be addressing that this fall.
Okay. So do we, I mean, we probably, since it's the health committee as well, this is a health issue, we probably should merge with you on that.
Yeah, we should do something jointly.
Particularly, I mean, my question about the unemployment, I have to assume this is affecting Medicaid, and we don't have endless money for Medicaid. What is that taken away from? If people are going to go on Medicaid to get the insurance, I don't know what's going to happen with it, and that's an issue.
Well,
I think that will affect the Black and brown, the poor community as well.
That is correct. Medicaid has been reduced. So there was a whole committee on the Medicaid rethinking committee, and they figured they carved out every available wiggle room in Medicaid. So where hospitals and doctors used to be, you could charge for one thing, and there was some wiggle room in Medicaid. Now there's no more wiggle room, and it's affecting patients. And what I'm seeing with my older adult patients is that they can't get the number of hours of home care anymore. So if somebody, for instance, you have somebody with Alzheimer's that needs to have somebody living in with them, but they can't get any more than 8 hours of care. And that means that they can no longer stay at home. So then they have to go into a nursing home. And then there's not enough space in nursing homes, and nursing homes are just not good. So you're forcing somebody into a situation where they could have been better taken care of at home. But
Ellen, I have a
less
question.
cost.
I have a
there's
question.
problems with it.
Okay, and I'm not sure that you can answer this question, but I know from as a Medicare beneficiary, I know that they have made a real effort to have people sign up for these Advantage plans, as opposed to traditional Medicare, okay? And so my question is, are they doing that with Medicaid as well? Like, in other words, if you have Medicaid and Medicare, are they trying to convince the Medicare part of your coverage to go on an Advantage plan?
They are.
Yes?
Are
Because
they
that's a
trying
real,
to do
now
that?
I understand what you're saying, because, that's.
Can I just say,
They're trying to merge people together, Medicaid and Medicare, so that and then those Advantage plans don't have network that the people need.
Right.
So
well, would that fit in? Because I would like to focus on the fact that this is a committee for racial injustice that we're talking about today. Would that fit in with it, do you think, or that would be at some future time we talk about it generally?
I mean, it's happening now. Yeah, it's happening now.
it would definitely fit. It would definitely fit in.
Well,
and
I've said it
definitely-
before and I said it again. I think the redistribution policies will kick in when they have a vaccine and we have to distribute it to everybody. And I think simultaneously that'll help alleviate this problem, which is fairly kind of systemic because it occurs in areas that are poor, distressed areas. And so I think we have to look at something like that. God willing, I think there'll be a vaccine and there'll be a systematic way of distribution for people who wouldn't otherwise be able to afford it and or adequate care.
So is there a way of separating this committee? I'm trying to now go back to saying what a committee is. Should it be an overarching committee? Is it like, should we break it up? Anthony and Wilma, do you think part of it is what you would be doing and we should do more nuggets? It seems like it's a very big chunk that we're doing.
Can I make a suggestion?
Sure.
Perhaps each one of us could take one topic and be the lead person on that topic, and then go see if we can find speakers that could talk to that topic. And that way we don't have to, one person doesn't have to do all the doesn't have to find speakers for all the topics. So we just break it up.
That works for me. That sounds good.
Because I know that I can find people to talk to the idea of racial injustice in the Medicaid system.
Oh,
so
great. Is that good for everybody? I don't want to say it's right.
And how the changes in the Medicaid system, the current changes are just blatantly unfair and just don't work.
If we divide up, we can have 2 meetings a month, maybe, because I think we have lots of meetings, right?
Good.
Alita, what do you think of that? Is Alita on?
Can you hear? If I may say something, Barbara, I think what you suggested is one of the more pressing things to be addressed now, which is health insurance. I mean, that covers everybody in our community. That's an issue that every single person in our community is worrying about. And it doesn't matter if you're poor or rich, they're worried about it. But it's so urgent with all this issue of lost jobs. And what if there is a second wave? More people will lose their jobs. So I think the committee would be doing the public a huge service if you could have a session on finding insurance and how you do it, regardless of whether you're old, young, rich, poor, but it's paramount on people's minds.
I think it's very important because I am having a problem at hospitals such as 33 and New York Hospital because my doctor is, he's retiring, and for 2 months he's tried to get a doctor out of those 2 hospitals to take my insurance. Not one doctor would take me on.
Yeah.
So now I'm forced to go. They told me to go to Metropolitan or Jacoby, or which I know those at those hospitals, those 2 particular hospitals, are mostly Black and brown people that get the services, and it's not very good. A lot of the areas are not very good. I'm not saying all of it's not good. It's a lot of areas. I don't think it's there. I've been in New York hospital special surgery for years. And now, just this day, a couple of days ago, when my doctor's retiring, I can't find anybody that's going to help me at New York Hospital or HSS. And that's all about money. If I don't have money, I won't have to worry about that. They'll pick me up in a minute. That's why I think it's not fair. That is just so unfair.
Wilma, I'm just sharing this from my experience. Try Mount Sinai, because Mount Sinai I had a similar experience where I changed insurance because I went to an Advantage plan. And so now I'm on the Advantage plan. I could not find a primary care physician who would take my insurance. So I called the MS Society, which has a really good like navigation department, and they finally found someone, but she was at Mount Sinai. So now all of my doctors, I was going to New York Hospital my entire life. My children were born there, you know, everything was cool. But now I'm attached to Mount Sinai because they took the Advantage insurance. So
Well, the thing with me is they've been trying for 3 years to get me more than a year at least to get me to get on Advantage Care on the Medicare part of Advantage Care. I refuse every time they try to get me on it because you get less services.
Yeah.
Yeah.
And now
No,
that
that's
I
true.
have,
Yeah.
yeah.
I understand. But then why?
So I never took Advantage Care. I never took that. I have in my mail this today about trying to encourage me. Oh, you're going to get more of this and more of that. It's not true.
Yeah.
Once you get on it, you stop.
Yeah, they do a big sell, and but you're right to stay on it if you can afford it and you can stay on, you know, the straight Medicare. I definitely recommend that you do that. But I was just talking about people who will, because I did switch to the Advantage plan, and I finally, like many of the New York doctors, don't want to take it, which is, you know, I understand because they're not going to make money. But
this conversation underscores the issue here, that there's a big problem about lack of information, and it's getting to be quite urgent under the circumstances.
Yeah.
Yeah.
I'm going to ask Ellen because she's the one that brought it up. I think what Peggy is saying, I agree. I personally agree with that. This idea of just what Sarah Chu said, the idea of a committee about our healthcare and how it has to change, and what's the problem with employment based, and certainly Medicaid would come into it because people that are not employed are going to go on Medicaid, and I think that there's a relation. I don't think we need a separate committee for it. Do you agree, Ellen?
No, we don't. I don't think so.
Repeat that last sentence. You don't think we need a separate what?
Separate meeting about Medicaid. You know, just what you were talking about. I think it could certainly be brought in this overall about why we need a change in our health insurance, of how our health.
Possibly.
I think possibly. That start off with that.
Possibly we don't have to get so granular with it.
Right. And then future times we can talk about it. But at this point, does anybody else have a comment about that? And I have one more thought that I would like really in some of my conversations with them.
Yeah, with Medicaid and Medicare, you're talking the national issue. Should we be starting on the state issue rather than, trying to climb up the hill? Why don't we climb the mount first before we go to the hill?
Although there is a portion that's the state also. But yes,
right.
I agree with Kaz. Not that it isn't a big issue, Ellen. But
no, it is. But
Medicaid is run by the state. The Medicaid, the decisions about what to fund and who to fund and whatever it's up to the state. I mean, there are lots of states where you go, like we're lucky that we live in New York, because New York is a big, they have a good insurance department, and they are very, they are more generous than others, shall we say, in Medicaid. If you move to, Kansas, or I'm just picking that out of the, ether. I don't know if Kansas is a specific one that doesn't do it, but there are lots of states that like really don't take the money or, whatever. Mm-hmm. So Medicaid is definitely a state issue.
No. It's definitely a state issue, but it's also a federal program. It's a
they
sharing
get the money.
program.
They get the money from the federal to start with, and then they dole it out.
There's a matching program, or there used to be.
It's matching federal and state.
But it's definitely more state than, say, Medicare, and it's also a question of locality matching, New York City matching, and it's always been a major issue for the states and localities who's going to pay their fair share.
Yeah, but I don't think this should all be about Medicare and Medicaid. I mean, people need to know how to go on Obamacare, how to get, other kinds of insurance.
Absolutely. That's the whole point.
Well,
Yeah, it's
the
not
only reason I
deficient. That's
brought
not
it
what
up-
it's at.
And if it comes up, it could be more of a sideline and then later on to specialize, to have something much more focused about it, I think.
Are you
The only
talking
reason I
about,
brought it up because Alita asked us to focus on,
The
on
insurance issues, I
know,
think.
privilege and healthcare inequities. So
healthcare and equities?
Because we're all unmuted and I want to keep doing this, let's just try really hard not to talk over each other.
Yeah, because I'm getting confused.
You're being abused?
I'm getting confused about what are we going to be doing, and what are we going to be doing in August? And we're getting stuck. We're getting stuck on big issues, and I didn't know this was going to be like this.
August, we're going to talk about preparedness. We have lots of topics we're talking about.
You do have lots of topics, and actually, if you have an overarching theme, such as health, equities, or insurance, or which is part of health equities or something, you can have, if you want to do it as forums, as hour-long webinars or something, you could do multiple ones in a month. We had the small business
That's
program
true. You're right.
every other week.
Yes.
So
people are going to go to what they're interested in. They're gonna participate in it, but it's a lot to deal with. It's a lot of it could be a lot of fun.
Little areas. I think that each one, and I'll go over the ed. And I'm not saying Medicaid couldn't be part of a discussion, but I personally feel that what Sarah wrote was just such an important thing, and that would be sort of a big meeting, forum, I don't know what the word would be. We will write it up and send it to everybody. I think Will and Rebecca can keep track of everybody that's here.
Yeah, always do.
Always do.
But there are many issues and topics we haven't had time to address, and I just want to make sure they're on the record and we can see how we want to explore them in the future. There's maternal mortality. That is a huge issue.
Right.
There was also a study that came out recently, and I've been a little overwhelmed with some work stuff, so I haven't had time to read it, but I was very shocked that it was a study, they wrote about it in the New York Times, that even among healthy children who undergo surgery, Black children are 3 times as likely to die than white children. Has nothing to do with, they're both equally healthy in the beginning. That is scary and alarming, and it's just not right. So there's all these other, and maybe there's way more implicit bias in the health care system than we even knew. So
they go to, or the public hospital as opposed to New York Hospital with a private doctor.
So there are just lots of there are lots of aspects to this that we should just acknowledge and bring up at some point.
Rebecca, those two really can be combined, couldn't they?
Well, could I say something here? Because maternal mortality ought to be something with the Women and Families Committee, it feels like, because it's women and it's families and it's healthcare. So if you guys want to talk to each other, and that's another way of doing more forums, is to combine with other committees like you did last night on the contact tracing and the previous weeks as well.
I have one other issue that I think Alita was in my conversations with you, I thought of it, and that's the public health. I will tell you, I have a slightly different point of view than Alita. I will just tell you, I'm on the board of Metropolitan Hospital, and I've been very impressed with what they have. Well, you're saying no because you're talking.
No, I'm saying that. I don't know why I'm being ascribed all of these horrible things. I don't disagree with you. I always talk about what you say, Barbara, about Metropolitan Hospital being strong. In fact, when I was talking to Dr. Long's assistant, either this morning or yesterday about the contact tracing, I said, and she asked what hospitals are in our district, and she talked about Metropolitan, and I told her about you and how enthusiastic you are. So public hospitals are essential. They're made.
So even if they're not good, and I really put Kohler slightly.
But some of them are good.
Kohler is, I don't know if it's a nursing home, it's a long-term care. It's different than Jacoby and Elmhurst. And
yes.
But the public hospitals have been trying hard. They have money problems. I think they will be essential. And then I can't remember which person I'm listening to, but they're talking about more community health centers also to deal with more equity until we get some change. I think that that could be an important topic to talk about. I don't know if it could be combined, but I would think that that could be a very important topic. And I know, Rebecca, that when I've been at meetings at Metropolitan, they talk about mortality, death with pregnancy and birth, postpartum and so on. I don't give us definite numbers. I will tell you a bunch of numbers.
I would ask that there be some kind of balance, that there be some programs on prescriptive recommendations, policy issues, and others on things like how to get insurance and how to deal with insurance and how to wend your way through bureaucracies or things like that that are practical and informative and that are not so much about public policy, but are educational and informative. And then you also have the public policy side of things, which is what you're talking about now. That's what I would suggest. Other than that, it's all really up to you guys.
Well,
And I'm sorry for cutting in so
part
much.
of the committee, Alita, so it's part of you too. So I don't want to discuss guys.
But at the same time, if you're going to get a speaker, I don't think it should be somebody that's going to promote their company. Because we've had some speakers and they'll say, oh, I'm with such and such a company and I do this and that and everything else. If we have speakers, it should be basically non-promoting themselves or their companies.
Oh,
it should be the issue.
But it could I think it could be somebody from the public hospitals, what they do, and somebody saying, but the public hospitals have problems.
No, but not getting a private person that works for a private company.
I don't think.
You're talking about health insurance?
No, just anything in general, because I think one night there was some meeting and some guy said, I work with such and such an insurance company. And it wasn't promoting himself, but he was promoting his company and basically what he was doing. We're just informational. We want information on what insurance are available, how we get it, the pros and cons of the Medigap, the Advantage plans, the straight plans. We don't want the names of companies. We want information and facts.
I totally agree. I went to a Liz Kruger, one of her things that were presenting, and it was people that were presenting.
Well, my other question is, what about all these walk-in small medical places that are springing up all over the place? I mean, that's going to put a lot of, relaxation on the hospitals. So if people go to these places rather than the hospitals, then the hospitals can concentrate on more urgent matters rather than just people walking in with a cold or with a sore or with just common things. So should we also be promoting these?
Well, I would call those communal. I'm not sure. I would think those are more like communal community.
But a lot of them are hospitals, though. Mount Sinai, Northwell, they're all springing up all over the place.
I'm not sure how that would fit in with what I'm talking about. Who else has something to say about that?
Well, those, what do we want to call it, like emergency care centers? That's what you're talking about, right, Kaz?
Yeah.
Yeah, okay. Those emergency care centers are actually promoted by the Advantage plans. And they recommend that you go to them if you have something that they can deal with. Now, they can't deal with everything, obviously. They can't deal with like a true, emergency that requires you to be, have the possibility of going, elsewhere. But for the everyday kind of, I've got like a little thing on my, knee, I want them to look at that, or I sliced my finger, or like whatever it is, those they can do. And the Advantage plans promote them by reimbursing you for more money than if you go to an emergency room. If you go to an emergency room, you get a little bit less money for reimbursement. So they're promoting those things. And
interesting.
Yeah, and it's like if you go to an emergency room and then you end up in the hospital, they pay for a lot more than if you go to the emergency room and they release you from the emergency room. So it's a whole, you know, it's a whole industry thing that they're promoting.
But
And also,
that would take a lot of pressure off the hospitals.
Off the
it
emergency.
would, but the hospitals, here's the thing that I understand about the hospitals is that the hospitals are really in trouble now. Like all of them are really in trouble because they make their money from like, you know, optional procedures and, you know, things that aren't necessarily, you know, for your health, but for like cosmetic things and things that are by choice, you know, that's where they make their money. And since the COVID thing, not only are they not doing those, but people are afraid to go to a hospital now because they don't want to be exposed, you know, to the COVID thing. So the hospitals are really in trouble. And I don't know what the answer is, but I just know that like that's a big problem. And I don't know if getting rid of their emergency rooms would help, only because the emergency rooms, they still do get reimbursement from the insurance companies. And then if they admit people to the hospital, then they have a patient, you know, so it's, yeah.
Right. I do know, for instance, Metropolitan Hospitals called something, I forget, do they call it urgent care or something like that? It is basically like CityMD in their hospital. And what's good about it is that if you go to CityMD with a bad stomachache and they think you have an appendicitis, they then send you to the hospital. Here, you're in the hospital and they'll send you in. And I think that they were doing well. I don't know what's happening now, but pre-COVID, they were just opening up and they were doing well with it. I don't know what's happening now. Do you have other issues? I see Rebecca.
You know, I think the main point of this meeting was to just kind of brainstorm, especially about issues related to racial equity. And because I know we had talked about in the fall doing something on seniors and mental health during the time of quarantine, COVID. But I just wanted to see if anyone else who hasn't spoken had any ideas. I think I saw Sherry's on, if you have anything you want to add, or any of the people calling in who aren't members of the board, just because we ran this meeting a little differently.
And just a reminder for everybody that they can unmute themselves. Unlike our normal meetings, you do not need to raise your hand. If you're on the phone, it's *6 to unmute yourself. And for everyone else, you know how to do it.
Could I just say something, Rebecca, about the mental health for seniors? That would seem to be something that might have some urgency. If there's I'm very pessimistic about this, about a second surge and another lockdown or something like a lockdown.
Originally, we wanted to actually have that be our meeting this month, but based on the conversation we had at land use, we thought it was important to show that, you know, we're putting our money where our mouth is and not wasting time to focus on these concerns.
But seniors, but it's also a racial equity issue, because a lot of seniors who have more money have access to private health insurance and private therapists and private ways of dealing with the quarantine, even like having access to technology and being able to FaceTime their relatives and their friends, and being able to watch nightly opera streams or look at museums or find access through other mechanisms of staying in touch with people. While with the technology divide that you were referring to earlier, people with fewer resources may not have that ability. So it crosses some different levels, and you're talking about social justice and providing mental health resources or helping people navigate that, would seem to have some significance, especially with the merger potentially of more virus and more people staying at home again, and we don't know about their health care. It's all part of the same thing to me, but if you want to zero more in on the racial issues, by all means, go ahead.
Good.
There's a few agencies in the district that could talk to that very nicely. I mean, that would make an interesting meeting, Alita.
But should that be the digital divide rather than the health? I mean, you can't
It's
put
not.
two,
Oh, I'm sorry, Kaz. It
can you?
it is part. It feels like the digital divide is part of it, but it's also people being able to afford what they can afford, or having family members who may think, okay, well, maybe you want to spend your time taking piano lessons online or learning Mandarin online, and other people may not be thinking that because they're worried about where they're getting food for their next meal. So it's technology, it's money, it's views of elderly people, and maybe other communities view elderly people as not disposable. So it's
Alita, I actually think that the seniors are pretty well taken care of. The
they are.
agency is very, very active in reaching out to their constituents, to looking into the community and seeing who's needy and who needs food, getting food delivered, Meals on Wheels, and all sorts of extra food has been flowing. I mean, it would make an interesting. It would make an interesting meeting that we, because maybe there are people that are being missed.
Well, it's also Peggy and Gail had done some work on food insecurity, and with the nationwide statistics. And yes, the Upper East Side does look after people a lot, but there are also lonely people, and the virus has special impacts, and maybe racial lines impact that. I don't know. It just feels like, and maybe everyone is subject to depression and anxiety and stress and all kinds of mental health issues, which is why Cuomo provided mindfulness and yoga and meditation and all kinds of stuff available at no charge for the public. So I don't know. I was just saying that it doesn't have to be limited to a non-racial equity issue, but if there's nothing there, if there's no meat on the bone there, then there isn't, and I'm mistaken, and that's fine.
Who would be the people coming to the meeting? Who would we be addressing? Who would we be inviting to that
Let's
meeting?
not get specifics, Ellen. It's getting late.
Yeah.
We've had it in there today, but Anthony, can Anthony talk? Yeah, Anthony.
Yes, I think if there is an August meeting, I think the issues of the sort of charge of this particular committee should be directed in August toward some kind of, excuse me, some kind of a notion of preparedness for September. And yes, it's partly schools, or maybe mostly schools, but it's all of the other things that go along with it. The governor may, in fact, have said that there are 30 states that have to quarantine, but it's up to individuals to do that. And I think that if we look next month, which is rapidly approaching, at ways in which we as a community are prepared or not prepared for what will inevitably come in the fall, I think that I think that would be an important service for us to do. And that's not necessarily tied to issues of racial equity, although in fact it might be, as people who are either here or not here or whatever. But the idea of concentrating on that in August, I think, makes a lot of sense.
Yes, I have a suggestion, unless we have more issues to bring up. How about if at least the three of us work on getting, I guess you can, a write-up of the meeting with some sort of agenda or a list of them, pass it around to everybody that's here and those that sent in, the Sarahs and the Billies and I know Lynn never got on the line, was it? Lynn is recuperating from surgery, and I know she's very interested in it too. And is that legal, Alita? We can pass this around, right? And
it'll be the minutes.
Right.
Yes, I'm sorry, I was muted. Yes, why wouldn't it be okay? Absolutely.
I don't know. I don't understand meeting law, so I just wanted to make sure.
And
It's all
do,
public.
Okay.
I do think that since we came up with this list together, when we want to decide, you know, what forum or what issue we want to go after first, I do not believe it would be a violation of the open meetings law to meet individually or kind of have mini Zoom meetings, and we can plan those meetings. And again, I thought the contact, maybe I'm biased because I was involved, but I thought the contact tracing series working group went really well. And I think we can do that for a lot of these issues.
I would like one other thing. Maybe what people would write back and said, I'm very interested in this issue. I'm very interested in this issue, to be able to take some of the lead, because this is overwhelming. I know Peggy has also, we've done forums and everything. They take forever. It's like a 50-hour week of working on them.
Not anymore so much, Barbara, because they're really much shorter. They're an hour, maybe an hour and a half.
Around, you don't have to look around, because even if, you know, people can zoom in, they don't have to travel.
Right, and you're not looking for space, and you're not.
But most of us are not going on vacation, unfortunately. So, you know, people are home, and August is just another month.
Well, no obligation on you guys, but if anyone would have me, I'm happy to work with anyone. I love doing these things.
Absolutely. Of course.
Yeah.
And
don't
even put it that way, you know.
And I think the other important thing to note is that Anthony and Wilma will keep working with you and making sure your committee is involved as well.
And maybe the coordination, maybe you'll say, why don't we do this part of it or something like that.
That's fine.
I love your hair.
Oh, thank you. Thank you.
I'm not sure if it's the front hair or the back hair that I'm.
Well, you know, I'm not sure how long I'm going to keep it, but.
I'm seeing people in various ways. All right.
Yes.
They have a nice summer, but no, you're not going to have a nice summer. We have to work.
Yes.
So if there's nothing else to be said.
No old business, no new business.
So excited. Are other people excited too?
Yes.
Sure. Got some good ideas.
Yeah.
I just before you go, I just want to remind you of the way that a lot of us see community boards, which is, as I mentioned earlier, to educate, to inform, to provide ideas, to provide a pathway to the government. And so these kinds of forums are all of those, because you can call in government agencies to appear on issues. You can have other outside speakers, and they're all really good. And if you get a big audience, great. And if you just meet one person's expectations and make a difference to that one person, then I feel like we've done something. So you guys are all really, you have had great ideas. I feel like the short end of the stick, but if you want to do August, that's great. And you don't have to, there's no obligation. It's really your committee. So forgive me for interrupting.
Started right before you got on. I said, I don't know, I'm going to tell you what Alita has talked about. So we already talked about it. And I think that, I know Peggy, you don't agree, but does everybody else agree that August we should aim for August? To be prepared for September, unfortunately.
And I think, again, just what I said earlier, that we totally understand if a board member can't come, because they're not usually expected in August. And then I think we have every right to go forward.
You're going on vacation.
Yeah.
Very jealous. So show up so we're not jealous.
And thank you, everyone, for coming and participating. And does anyone have a motion?
Quick question. Are you going to send a Google Doc? Are you going to start a Google Doc about like ideas, or like what's the next step? What's the next thing we should do? Should we write our own and send it around? Like what do you want to?
Should we do the minutes on a Google Doc? I don't know. What do you want to do?
No, I think since this is a formal committee meeting, we'll have to have the minutes, and we'll work together, the three of us. I always take crazy amounts of notes, so we'll try and make sure everything gets listed, and that can be the starting point for continuing the ideas.
If I can just make a suggestion, you may want, when you're sending ideas around, not to attribute them to anyone, so that there's no reaction to someone liking or not liking the person making the suggestion.
what I
Good
meant
idea.
was, if you say, I'm really interested in the preparedness one, which I assume you are, Alita, that you would say, I'm interested in this, or some sort of note. And if Peggy says, well, if we put in nursing homes, and Peggy says, our committee is doing this, you could be joint with us, Peggy, that type of thing. Or if Billy and Wilma say, I want to do the criminal justice part of it, or that type of thing. That's what I meant. I didn't mean to say somebody said no to this, but everybody else said.
No, I wasn't meaning that. I was just meaning that when you're sending around like if you're just sending it around, to just say, these are suggestions that were made, how do you feel about them? Rather than saying that Wilma and Billy suggested, or Peggy or Alita or somebody else, so that.
No, let's just do it, but hopefully maybe some note that.
Yeah, just a list of primary topics, generic topics would be fine.
Right.
Things that we think are.
I have one more question. I'm sorry to be the question delayer of meetings. This is actually for Will. Will, is this record, like I see on my screen, it says live on YouTube. Is this recorded at the
Yes.
same time? Okay, so then I'm going to raise the question of, is it necessary for us to have minutes, since the whole
Yes.
thing is?
100%.
Yes.
And that
Yes,
is
by the
why.
executive order, we're still supposed to be making minutes.
It-
They didn't suspend that part of the open meetings law.
All right.
I am not 100% sold on Zoom meetings forever, as I've made clear in other meetings. But one great thing is, unlike previously when only our full board was streamed, now everything is streamed. So that is one great thing, but we still need minutes.
A lot easier to do the minutes. I'll do the minutes. I don't mind doing minutes if everybody else helps, but I don't take notes. What I do is I listen to the Zoom meeting.
I
always thank Will
Anyone?
for this unbelievable job of putting it all together.
Yeah. Anthony, I think, has a motion.
Yes, motion to adjourn.
Second.
Goodbye, everybody. Thank you.
Thank
Bye-bye.
you.
Thank you.
Bye,
Thank you.
everyone.
Bye, Will.
Bye.
Night.
I